That ringing in your ears right now? That high-pitched whine that never stops? That hiss that follows you from the bedroom to the kitchen to the middle of the night when you're lying there staring at the ceiling begging for silence? I need you to hear me on this. That is not just an annoyance. That is not just something you learn to live with. That ringing is your brain screaming for help. It is a distress signal, and if you ignore it long enough, what comes next is far worse than noise. I'm Dr. James Hargrove. I've spent over 30 years in internal medicine specializing in patients over 60, and I have watched tinnitus destroy people. Not slowly, not gently. I've watched it take away sleep, take away conversations, take away marriages. I had a patient tell me last year that she hadn't heard true silence in 11 years. 11 years. She told me she'd forgotten what it sounded like. And the worst part, the part that keeps me up at night, is that for most of my patients, the ringing was fixable. Their bodies were missing specific nutrients and nobody bothered to check. Today I'm going to show you exactly what your body is lacking, why standard blood tests miss it, and the precise protocol that has turned the volume down, and in some cases completely off, for patients I've treated personally. But I'm also going to be honest with you about something. If you've been suffering for years and you've already tried supplements and nothing changed, I know exactly why, and I'll explain that too. Stay with me on this one. This might be the most important 15 minutes you spend this year. Let me start with what's actually happening inside your ear, because once you understand the machinery, everything else makes sense. Deep inside your inner ear, past the eardrum, past those tiny bones you learned about in school, there's a snail-shaped structure called the cochlea. Inside that cochlea are approximately 16,000 microscopic hair cells. These hair cells are the translators. Sound waves come in, these hairs bend, and they convert that mechanical vibration into electrical signals that travel up the auditory nerve to your brain. That's how you hear your grandchild's voice. That's how you hear music. That's how you hear the person you love say your name. Now here's the problem. These hair cells are fed by one of the smallest, most fragile blood vessels in your entire body, the labyrinthine artery. It is thinner than a strand of hair, and unlike your heart, unlike your kidneys, unlike almost every other organ, your inner ear has no backup blood supply. None. If that tiny artery gets even partially blocked, if blood flow drops even 15 or 20%, those hair cells start to starve. And when they starve, they don't just go quiet, they malfunction. They start firing randomly. Your brain receives these chaotic signals and interprets them as sound, a ringing, a buzzing, a hissing, even though there's nothing there. Your tinnitus is not a sound, it's a symptom. It's your hair cells dying and sending out distress flares on the way down. A landmark study from Newcastle University published in 2025 confirmed this. They found that tinnitus is driven by abnormal neural synchrony, groups of neurons in the auditory cortex firing together when they shouldn't be, like a choir where half the singers are on the wrong page. And what drives that abnormal firing? Nutrient deficiency, vascular insufficiency, inflammation. 3 things that are rampant in adults over 60, and 3 things that are almost entirely within your control. I want to tell you about a man named Gerald. Gerald came to me at 67. He'd had ringing in both ears for 4 years. Constant, high-pitched. He described it as a tea kettle that someone left on the stove and walked away from. His previous doctor told him, and I quote, "There's nothing we can do. You just have to learn to live with it." Gerald looked at me across my desk and said, "Doc, I can't live with it. I haven't slept more than 3 hours in a row in 2 years. My wife moved to the guest bedroom because I keep the television on all night just to drown it out. I don't go to restaurants anymore because I can't hear anyone over the noise in my own head. I feel like I'm losing my mind." The first thing I did was run a full micronutrient panel. Not the standard blood test your regular doctor orders. I mean a comprehensive panel that looks at intracellular levels, not just what's floating in the serum. And what I found was striking. Gerald's serum zinc level was 72 micrograms per deciliter, technically normal. Most doctors would look at that number and say, "You're fine." But here's what most doctors don't know. Serum zinc only reflects about 1% of your total body zinc. The other 99% is inside your cells, in your tissues, in your bones. Gerald's intracellular zinc was critically low, and zinc is not optional for your hearing. Zinc is concentrated in the cochlea at levels higher than almost anywhere else in your body. It protects those hair cells from oxidative damage. It's essential for the enzyme that converts sound signals into nerve impulses. A 2023 meta-analysis published in the International Journal of Audiology reviewed 14 randomized controlled trials and found that zinc supplementation reduced tinnitus severity by an average of 31% in patients who were deficient. 31%. That's the difference between a scream and a whisper. But here's what happened with Gerald that nobody had caught in 4 years. Gerald drank 3 cups of black tea every day. He took a calcium supplement with lunch, and his doctor had him on a proton pump inhibitor for acid reflux. Every single one of those things blocks zinc absorption. The tannins in tea bind to zinc in the gut and carry it straight out. Calcium competes directly with zinc for the same absorption pathway. And proton pump inhibitors reduce stomach acid, which is required to liberate zinc from food so your body can actually use it. Gerald was eating a decent diet. He was even taking a multivitamin with zinc in it. But his body couldn't absorb any of it. He was pouring water into a bucket with a hole in the bottom. We separated his zinc supplement from his tea by 3 hours. We moved his calcium to the evening, away from zinc. We worked with his gastroenterologist to step down the proton pump inhibitor. Within 6 weeks, Gerald called my office. He said the tea kettle had turned down. Not off, but down. By 3 months, he told me it was like the sound had moved from the center of his head to somewhere behind him, further away, like it was in the next room instead of inside his skull. He slept 5 hours straight for the first time in years. His wife moved back into their bedroom. Now, zinc is just the beginning. Let me talk about vitamin B12 because this one is a silent catastrophe in people over 60. Your body needs B12 to build and maintain myelin, the protective coating around your nerves, including your auditory nerve. Think of myelin like the insulation on an electrical wire. When that insulation breaks down, the signal gets scrambled. Static, distortion, ringing. Here's the scandal. The standard reference range for B12 in most labs is 200 to 900 picograms per milliliter. So if your level comes back at 210, your doctor says normal and moves on. But research from Tufts University has shown that neurological symptoms, including tinnitus, numbness, balance problems, and cognitive fog, can begin at levels below 400. Japan actually changed their threshold years ago. In Japan, anything below 500 is considered deficient. In North America, we're still using a range that was established decades ago and hasn't been updated. I had a patient named Patricia, 71 years old, who came to me specifically about tinnitus that had started 5 months earlier. She was precise about the timing, which immediately got my attention. When a patient can pinpoint when their tinnitus began, I always ask what else changed around that time. Medications, diet, stress, surgery. Patricia thought about it and said, "Well, my doctor switched my blood pressure medication and started me on metformin for pre-diabetes around that same time." There it was. Metformin is known to deplete B12 over time. The American Diabetes Association has warned about this since 2017. And certain classes of blood pressure medications can affect inner ear blood flow. Patricia's tinnitus wasn't random. It was iatrogenic, caused by her treatment. This brings me to something critical. There is a category of medications called ototoxic drugs, drugs that are directly toxic to the structures of your inner ear. And many of them are extremely common. High-dose aspirin, certain antibiotics like gentamicin, loop diuretics like furosemide, some chemotherapy agents, even ibuprofen at high doses over long periods. I'm not telling you to stop taking any medication. Never do that without your doctor's guidance. But if your tinnitus started or worsened around the time a medication changed, that is not a coincidence. That is a clue, and you need to bring it to your doctor's attention. For Patricia, we worked with her prescribing physician to find alternative medications that were less ototoxic. We started B12 supplementation, methylcobalamin, not cyanocobalamin, because the methyl form is already bioactive and doesn't require the conversion step that becomes less efficient as you age. Within 4 months, Patricia's tinnitus was roughly 70% reduced. She told me, "I forgot it was there for an entire afternoon last Tuesday. I actually cried when I realized it." Now I want to address something directly because I know some of you are sitting there thinking, I've heard all this before. I've taken zinc. I've taken B12. I've taken magnesium. Nothing changed. I hear you, and I believe you. But let me tell you about a man named Arthur, because Arthur was you. Arthur was 69, a retired engineer, and he was methodical about everything. When his tinnitus started at 63, he researched it exhaustively. He started taking zinc picolinate, methylcobalamin, magnesium glycinate, vitamin D3, and a high-quality fish oil. He took them religiously for 2 years. His tinnitus didn't budge, not 1 decibel. He came to me frustrated and honestly a little hostile. He said, "I've done everything the internet says. I've done everything other doctors suggested. None of it works. This is snake oil. I just have to live with this." I asked Arthur one question that changed everything. I said, "Arthur, what time of day do you take these supplements?" He said, "All of them in the morning, with breakfast all at once." And right there was the problem. Your inner ear repairs itself on a schedule. The cochlea's repair mechanisms are tied to your circadian rhythm, your body's internal clock. A 2024 study published in the journal Cell Reports found that the genes responsible for hair cell maintenance and antioxidant protection in the inner ear are most active during the late evening and overnight hours. When Arthur took all his supplements at 7 in the morning, the nutrients hit his bloodstream by 9 or 10 a.m., and by the time his inner ear's repair window opened 12 hours later, the water-soluble vitamins were largely excreted, and his magnesium and zinc levels had already peaked and declined. We restructured Arthur's protocol completely. Zinc and magnesium moved to the evening, taken 2 hours after dinner, away from any calcium or tea. B12 stayed in the morning because it can affect sleep in some people. D3 moved to lunch, taken with a meal containing fat for absorption. And his omega-3 fish oil was split, half with lunch, half with dinner. Same supplements, same doses, different timing. Arthur called me at week 8. His voice was shaking. He said, "Doc, I woke up at 3 in the morning last night and for about 10 seconds there was nothing. Complete silence. I haven't heard silence in 6 years. I laid there afraid to move because I didn't want it to stop. It came back, but it was quieter. And those windows of silence are getting longer. That's what I mean when I say the problem isn't always what you're taking. Sometimes it's how and when you're taking it. Your body has a clock, and if you're not working with it, you're working against it." Let me now cover the nutrient I think is the most underrated in tinnitus treatment: magnesium. Your auditory nerve cells communicate using neurotransmitters, and one of the most important is glutamate. Glutamate is the gas pedal. It excites the nerve to fire. But you also need a brake. Without a brake, those nerve cells fire continuously, and that continuous firing is experienced as ringing. Magnesium is the brake. It physically sits in the glutamate receptor and prevents it from being overstimulated. When magnesium is low, the brake is off, and your auditory nerves fire like a car alarm that won't shut up. A study from the Mayo Clinic found that patients with tinnitus had significantly lower intracellular magnesium levels compared to age-matched controls, even when their serum magnesium was in the normal range. The same problem we saw with zinc. Serum levels don't tell the full story. Roughly 60% of Americans over 60 are magnesium deficient, and most of them have no idea because the standard blood test says they're fine. Vitamin D3 is next, and this one surprises people. Vitamin D isn't just for bones. It's a neurosteroid. It crosses the blood-brain barrier and directly affects how your auditory cortex processes signals. A 2024 systematic review in Nutrients found that adults with tinnitus were 3 times more likely to be vitamin D deficient than those without tinnitus. 3 times. And when deficient patients were supplemented to levels above 50 nanograms per milliliter, tinnitus severity scores dropped significantly within 12 weeks. And omega-3 fatty acids. These are the blood flow story. Remember that labyrinthine artery, the thinnest blood vessel feeding your inner ear? Omega-3s reduce blood viscosity. They make your blood flow more smoothly through that microscopic channel. They reduce inflammation in the vessel walls. They protect the myelin sheath around your auditory nerve. A 2023 study in the American Journal of Clinical Nutrition followed over 68,000 women for 18 years and found that those who consumed 2 or more servings of fatty fish per week had a 20% lower risk of developing tinnitus compared to those who rarely ate fish. Now here's the part nobody talks about. The things that are making your tinnitus worse right now. 3 things you need to reduce or eliminate. First, excess sodium. When you eat a high-sodium meal, your body retains fluid. That fluid retention extends to the inner ear, increasing pressure in the cochlea, swelling the tissues around those delicate hair cells. Many of my patients report that their tinnitus spikes within hours of a salty meal. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for adults over 60. The average American consumes over 3,400. That's more than double. Second, caffeine in excess. Now, I'm not going to tell you to quit coffee entirely. Moderate caffeine is actually associated with some vascular benefits. But more than 2 cups a day constricts blood vessels, including that already microscopic labyrinthine artery. If your tinnitus is louder in the morning after your 3rd cup of coffee, that's not a coincidence. Third, and this is the big one, chronic noise exposure without protection. This includes earbuds at high volume. This includes mowing the lawn without ear protection. This includes sitting in a loud restaurant for 2 hours. Every time you expose already damaged hair cells to excessive noise, zinc on the planet. And ginger is a natural anti-inflammatory that has been shown to improve microcirculation, blood flow through the smallest vessels. Let me be clear about expectations. This is not an overnight fix. I tell my patients to commit to 90 days before they judge the results. Your hair cells didn't start dying yesterday, and they won't repair overnight. But what I've seen clinically, over and over, is that patients begin noticing changes, often subtle at first, somewhere between week 4 and week 8. The ringing gets a little softer. The moments of quiet get a little longer. Sleep starts to improve, and once that positive cycle begins, it tends to accelerate. I want to close with one more patient because she's the reason I made this video. Her name was Margaret. She was 74 when she first came to see me, and she almost didn't come at all. She told me later that she'd canceled the appointment twice because she was convinced nothing would help. She'd had tinnitus for 9 years. 9 years of a sound she described as a dentist drill that someone left running in the back of her head. She'd seen 4 specialists. She'd tried hearing aids, sound therapy, antidepressants, a hypnotherapist, even an acupuncturist. Nothing worked. When Margaret sat in my office that first day, she was thin, exhausted, and she spoke very quietly, like someone who had given up. She said, "I'm not here because I think you can fix this. I'm here because my daughter made me come. I just don't want to do this anymore." The way she said that last part, "I don't want to do this anymore," it stopped me cold. I knew she wasn't just talking about the tinnitus. We ran the full panel. Margaret was deficient in zinc, B12, magnesium, and vitamin D, all 4. She'd been on a proton pump inhibitor for 12 years. She drank 4 cups of tea daily. She took a calcium supplement every morning. She was on metformin. Every single one of those things was working against her. She had never been told. Not once. Not by any of the 4 specialists she'd seen. We restructured everything. Timing, forms, absorption. We coordinated with her other doctors on the medications. And then we waited. At 4 weeks, Margaret said she didn't notice anything different. I told her to stay the course. At 6 weeks, she called and said she thought maybe the pitch had changed slightly. She wasn't sure if she was imagining it. At 10 weeks, she came into my office and sat down, and she was different. Her posture was different. She looked at me and said, "It's quieter, not gone, but quieter. I heard a bird outside my window this morning, and I realized I hadn't heard a bird, really heard one, in years because the drilling was always louder." At 5 months, Margaret told me she'd gone to her granddaughter's piano recital. She sat in the front row, and she heard the music. Not perfectly, not like she was 20, but she heard it. And when it was over, her granddaughter ran over and said, "Grandma, could you hear me?" And Margaret said, "I heard every note, sweetheart, every single note." She told me that she sat in her car afterward and cried for 20 minutes. That ringing in your ears is not a life sentence. It is a signal. Your body is telling you it needs something, and in most cases that something is specific, measurable, and fixable. You don't have to learn to live with it. You don't have to accept it, but you do need to act on it, and you need to act on it correctly. The right nutrients, in the right forms, at the right time, with the right absorption strategy. If this video helped you understand what might be happening inside your ears, share it with someone who's suffering in silence, and I mean that literally. And if you haven't already, subscribe to this channel because every week I bring you the research and the protocols that your doctor probably doesn't have time to explain. I'm Dr. James Hargrove. Take care of those ears. They're the only ones you've got.